Good afternoon. My name is Violet McLeod, and I will be your moderator for today's press conference. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Ian Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Premier, go ahead.
Thank you. Good afternoon, everyone. Before I get into the briefing, I just want to recognize that this week is National Volunteer Week, and we all appreciate the time and effort that Nova Scotians have been putting in over the last year, especially to do with COVID and continuing to fight the virus. We have a number of Nova Scotians stepping up to work in our pop-up testing clinics. I'm going to visit one after the briefing today at the Convention Centre, and I would encourage all Nova Scotians to make that as part of your regular routine. I think my Minister of Health is over there. If he's not now, he will be soon, and I've encouraged my colleagues to do so as well. And all the volunteer efforts around helping out your neighbours, giving them a call, dropping off food to those self-isolating. It has been the Nova Scotia thing to do over the last year. Now the state of the pandemic. We have 9 new cases today. 6 are in the central zone, 5 are close contacts, and 1 is under investigation. 2 in the western zone and 1 in the eastern zone, all those related to travel. Unrelated to today's cases, we have 2 new cases of the UK variant, and they were all previously reported cases to travel. So that gives us 68 active cases of COVID-19 in the province, 2 in hospital. We are concerned about the rising cases in our province, and Dr. Strang will talk about the details of those in just a moment. But in consultation with public health, our government is committed to responding to this ever-changing situation in our province in order to protect health and safety of Nova Scotians. In light of the rising cases related to travel in the province, we have decided to restrict non-essential travel into Nova Scotia. This means all Nova Scotians, unless their travel is essential, should not leave the province. It also means that those people who live outside Nova Scotia should not travel to our province unless that travel is essential. So let's be clear. Thursday, April 22nd at 8 a.m., you cannot come to Nova Scotia from outside PEI or Newfoundland unless it is essential. Dr. Strang will outline what we mean by essential in a few minutes. I know that some may be disappointed by this, but as Premier, I have committed to ensure that we continue to look out for the public safety of Nova Scotians and take action where required. We need to be flexible with our approach, and this means that this time we need to take a step back. When Dr. Strang and I are confident that cases are well under control, we can make an adjustment. We all have a responsibility for what happens here in Nova Scotia. We have done an amazing job at keeping our COVID cases low, so let's not stop now. Don't travel outside the province unless you need to. Follow public health protocols. Keep your social circle small. And please get tested and stay home when you're sick. There's been talk about the Ontario situation this weekend. I did have a conversation with the Prime Minister and the Premier for Ontario. We will not be reallocating our vaccines, but we continue to look at what resources we may have available in the province to see if we can step up to help our fellow Canadians. I'll give you a quick update on the vaccine rollout before I turn it over to Dr. Strang. As of yesterday, we have 21.9% of Nova Scotians that have received 1 or more doses of vaccine. That's 216,000 doses of vaccine administered. In addition to the pharmacy clinics, community and primary care clinics are running this week. We also have the Mi'kmaq Native Friendship Centre and 3 shelter clinics running. Yesterday, we expanded to include Nova Scotians aged 60 and older, and there are appointments available across the province. If you're eligible and haven't booked yet, please do so by going online or calling the toll-free number. As we have noted all along, our vaccine supply continues to be contingent on deliveries from the federal government. There does continue to be significant variation in supply volume and arrival date. For this week and next, our vaccine shipments have been the lowest they've been since mid-March. That means we will have fewer appointments to add into the system. So I will caution that this could result in taking a little longer for the entire cohort of 60 to 64 to book their appointments. We have 76,000 people in this age group, So that combined with the lower volume right now could mean that when you go online to book, you may not be able to book, but come back again, and rest assured you will have an appointment ready soon. At this point, the supply issues we know about are not expected to impact our commitment to ensure that all Nova Scotians get a vaccine, get their first dose by the end of June. But we're watching this closely. We have built a vaccine program that is flexible, reliable, and equitable. And then we are well positioned to deliver whatever supply we get into this province. Thanks, and I'll turn it over to Dr. Strang.
Thank you, Premier, and good afternoon, everyone. I'm happy to say that I got my first dose of COVID-19 vaccine today or this morning at the Halifax Forum Community Clinic. And I did have the pleasure of being vaccinated by the same public health nurse, Roberta Banfield, who gave me my H1N1 vaccine 11 and a half years ago. She hasn't lost her touch, and I told her that she needs to be there when I come back from my second dose of the COVID vaccine. I'm happy and relieved to have had my first dose and do my part to keep myself and others safe. And I'm extremely grateful to the many people across this province who have been working tirelessly for the past several months to develop and implement our vaccine program. Since we were last here on Friday, we've announced 39 confirmed cases of COVID-19 and confirmed 24 additional previously announced cases as variants. Unfortunately, I'm not entirely surprised we were seeing an increase of cases, given the Easter long weekend was about 2 weeks ago. We're also seeing a lot of positive cases associated with travel. Some of these are explainable and temporary foreign workers and rotational workers, but others aren't. And given the impact that these travel cases are having on Nova Scotia's epidemiology, we are taking a significant step to tighten our borders. Starting Thursday, April 22nd at 8 a.m., you cannot come to Nova Scotia from outside PEI in Newfoundland unless it is essential, period. There is a temporary measure that will, this is a temporary measure that will be in effect for 4 weeks. But if we need to, we will extend this time and put further restrictions in place. So for the next 4 weeks, people can only enter Nova Scotia for essential reasons, which include if you live in Nova Scotia but your permanent employment is in another province, you can go back and forth, and this includes rotational workers. If you are a federally approved temporary foreign worker, if you're a specialized worker who is needed for urgent, critical infrastructure work necessary to help the province function, no other specialized workers will be permitted. If you are returning after participating in a required legal proceeding outside the region, you certainly are allowed to come back. If you are moving to Nova Scotia and can demonstrate that you already have a new permanent address here as of April 21st. So that means that if you purchased a place before April 21st, you can come here. But we're telling people that they should not, now is not the time to be looking to purchase something in Nova Scotia for the next 4 weeks and anticipate you can move here. You have to have purchased your new permanent residence in Nova Scotia before April 21st. If you are traveling for post-secondary education, and this is both the returning students and the parents, if the parents needed to go pick them up, and if the students are in other provinces attending school, then those people can come back. And the last group is if people have a child custody arrangement, we have to allow that to happen. For all these scenarios, a full 14-day quarantine for the travelers is required. We will be increasing our enforcement of that quarantine to make sure people are quarantining as required, but we're also asking Nova Scotians to help. Please do not socialize with family and friends who are meant to be quarantining. One of our current clusters was the result of family and friends gathering with people who had recently come from Ontario. So we need to enforce the quarantining piece, but we need Nova Scotians to make sure that they are not choosing to socialize with people who are meant to be under quarantine. Please do support people who are quarantining with food and other essentials, but do not have close contact. Doing so, as we can clearly see, puts us all at risk. Anyone who is currently exempted under the public health order can also enter or return to Nova Scotia without isolating, but they have to follow the exempt traveler protocol. And this includes people, they've been exempted throughout the pandemic. So people who need to travel for essential medical services, anyone coming in to participate in a legal proceeding, and those who move essential goods, services, and people across the border, like long-haul truckers, airline crew, and we also include members of the military and first responders who may have to travel between Nova Scotia and New Brunswick. We are also going to be allowing fewer compassionate exceptions during this 4-week period. This means that people will not be allowed to travel to Nova Scotia from outside Atlantic Canada for funerals, and only in exceptional circumstances for end-of-life visits. And finally, we're making a couple of additional changes to the protocols, followed by those who regularly travel. For the next 4 weeks, rotational workers will have to fully isolate from their family members. That can be done under the appropriate protocol in the same home, but they have to fully isolate until they get their first test result back, and that test result is negative. After they have received that negative test result, they can follow the modified isolation protocol that allows them to interact with their family and be in outdoor places in the community and go to medical appointments. But that's only after they've received the negative result from their first test. And that is the same of what other Atlantic provinces are doing. For the next 4 weeks, people who travel regularly across the New Brunswick and Nova Scotia border can do so without isolating for work or school purposes, but we have a clear protocol that they need to follow if they're doing that. To everyone else, we are saying do not travel to Nova Scotia at this time. If you come here and your travel is non-essential, you will be turned away or required to isolate at your point of entry at your own expense. If you have a seasonal home in Nova Scotia, but your permanent residence is elsewhere, do not come until May 20th at the earliest. And if you are a permanent resident here in Nova Scotia, we're asking that you do not travel outside of Nova Scotia unless it is absolutely essential. And if you have traveled outside of Nova Scotia, you won't be denied entry on return, but you will have to follow the quarantine requirements like anybody else. We hope that these border measures are short-term, but we are prepared to extend them if necessary. So along with the increased travel cases, we now have several small clusters of cases in the Halifax area for which we have not yet been able to clearly identify the original source of infection. There are early signs of possible community spread in the Sackville, Halifax, Dartmouth, and Lawrencetown areas. Investigations are ongoing. We are monitoring the things closely and doing broad testing. We will take early and stronger action if necessary. In addition to testing of cases and contacts as directed by public health, anyone who lives in these communities should get a COVID test, whether they have symptoms or not. The primary assessment centers in the central zone have increased capacity, so please go online to book an appointment for a symptomatic or asymptomatic test if you're from one of those communities. You can also visit a pop-up test or clinic. There is one at the Halifax Convention Centre today until 7 p.m. and at the Sackville Sports Stadium today until 5:30 and tomorrow from noon till 7:30. And Nova Scotia Health is also working to have our public health mobile unit at the Bethel Church in Halifax in the coming days. We're currently using the mobile unit to do supporting some of the schools where there's been cases around testing. So when we have specific times and dates, Nova Scotia Health will be communicating that. I do want to make a point of clarification on the additions we made to mandatory masking policy that was announced last week. There's been a lot of questions and perhaps confusion. You do not have to wear a mask in all outdoor locations. However, along with the indoor public places that are required, masks are now required in outdoor public places where it is difficult to maintain physical distancing. This includes places like farm markets and special events such as festivals. Masks are also required when you're on a restaurant or bar patio, except when you're seated and actively eating or drinking, just like when it's inside. However, I would encourage, if any Nova Scotians are in situations outdoors or in private places where masks aren't required, if they're feeling uncomfortable around how close they are around people, there's never wrong to put on a mask and ask others around you to put on a mask. So in closing, I will say that while I do not want to create panic in anyone, we do need people to pay attention. This increase in COVID-19 activity is a warning sign. We have been in this position before, and we've worked together to reduce case numbers. The border measures are critical and will help, but there are things that all of us need to do as well. Focus on what you yourself can do to keep your family and your community safe. Don't travel outside of Nova Scotia unless it's essential. Tighten up your own personal and COVID or family COVID protocols. Limit your social activities and keep a consistent small social group. Do not have close contact with people who are supposed to be quarantining or isolating, whether it's from travel or they're a close contact of a known case. Wear your mask where required, and even in places where it's not required, but where you are in close contact with people outside your family or close social group. Get tested regularly and stay home even if you have, and arrange a test even if you have one mild symptom. And please book an appointment to get your COVID-19 vaccine as soon as you are eligible. The closer we get to population immunity through vaccination, the safer we all will be. If we all do what we need to do now and tighten up COVID protocols in our personal, family, community, and work lives, we will reduce the likelihood that we will need stronger, broader public health restrictions. We are asking Nova Scotians to once again step up to the COVID challenge, and we are confident that you will.
We will now take one question and one follow-up from media in the amount of time we have for today. And we will begin with Shayna Luck, CBC.
First question might be for the Premier, possibly for Dr. Strang as well. Dr. Strang mentioned border measures increasing. Can you say, Premier, how many people are staffing at the border currently, and how this might need to change given that you've strengthened the restrictions quite significantly?
Dr. Strang may have the exact number. I know that we do have significant presence there, and they needed just a little bit of time to ramp up for this restriction.
Yeah, I don't have an exact number. I have a lot of discussions. Teams are working on this from last night through today and tomorrow, working at all the details, so we're ready to go for Thursday morning. We'll probably be able to get you a definitive number tomorrow about what it will take to increase staffing, along with other measures at the border. We also have to, there's a lot of work that's going on. Everybody who comes in has to do their digital safe check-in. So we're also in the process of changing that whole digital safe check-in to make sure people are aware of who can and cannot travel.
Shayna, go ahead with your follow-up.
I just want to clarify as well on one of the restrictions related to that. Are you saying, Dr. Strang, that people who are in Ontario or other provinces now could not buy a home in Nova Scotia from there and then come here to live in that?
So if somebody, we're saying that if they buy a home after April 21st, and in the next 4 weeks, if they come to the border and say that they're going to come in, they will not be allowed to come in. People may have already purchased the home, so we're saying if you bought your home before April 21st, you'll be allowed in, but you have to follow a strict 14-day quarantine. But we're giving people notice now. We're saying put a pause, wait for at least the 4-week period. We need to stop the flow of people coming into the province for non-essential reasons, including moving here. Now is not the time. We need to just slow everything down. People will get time when we're safer to move to Nova Scotia, but right now is not the right time.
Next, we'll go to Lindsay Armstrong with All Nova Scotia.
Thank you. I'd like to learn a little bit more about these border measures. What will that process look like crossing the border on land or at the airport? And I'm wondering too, why now? It's my understanding this would be the first time that we've sort of held this, and more about the restrictions and why now.
So we're working through the process. If it starts with that digital check-in, so people will have to go through and fill in the digital check-in, and they'll have to have an approval that they can show when they arrive at the border. If they don't have that approval, and there may be other pieces of information, like we've said, if people are moving here, they need to show that they have a permanent residence in which they're moving, and when they took what was the date of that. If they don't have that, or if they don't have an approval from the digital check-in, they will be turned away. We're working the details of how that will look at the land border. If they're at the airport, we're working through the details, but we would put them, they say, at their own expense. If they don't have approval, they will have to go into a hotel where they can either choose to be strictly quarantined for 14 days, or they can stay in that hotel quarantine until they can get a flight back home. We will turn people away if we have to. And sorry, your other question?
Why now?
If you look around, it's that the volume of what we're hearing is the significantly increasing volume of people coming. We heard yesterday from our border folks that recently there's been a 400% increase of people coming across at the land border. But especially in the context of the variant strain, which is much more transmissible. Everybody coming in, especially from other parts of the country which have high rates of COVID, have a high risk of having the virus themselves. And then if they're in here and it's much more transmissible, that's what we're seeing. We need to do this to avoid the third wave. It's slowing down the introduction of virus. It's what we've done all along. Restrict the border to slow down the introduction of the virus, so the numbers of cases that come through that we can manage within our resources and prevent spread into the community.
Wondering if you can tell us any specifics about what you're willing to offer Ontario in terms of support. I know the topic of ventilators and human resources have been brought up. I'm wondering if there are any details on either of those.
Yeah, I don't have firm numbers. I know we have ventilators available. It's a question of whether or not Ontario could use those. They're focused on resources more around nurses, ICU nurses, and doctors. We have to be mindful. We have limited resources looking at our situation here. So we thought about having a call out to retired nurses. We have some working at our vaccination clinic. So that's the type of creative thinking that we're thinking about. I can't guarantee you that we'll be sending anything, but I think it's definitely something we should be considering.
Next, we'll go to Global, Alicia Drouse.
Dr. Strang, on Friday you had indicated that you were seeing a decrease of interest in AstraZeneca, obviously just because of all the chatter around the rare blood clots. A number of other provinces have now reduced the age category that are eligible for AstraZeneca. I'm just wondering if there's any interest in doing that here, particularly when it's 55 and above, and they're the next age group who will be eligible for Moderna Pfizer. So is there any change in that?
Yeah, I'm looking at the clock because I don't know if the National Advisory Committee on Immunization is releasing a statement on this today. It may or may not be out. I was involved in lots of conversations on the weekend. The NACI statement is based on where and how you use AstraZeneca, finding the right balance and risk and benefit. What their recommendation is that it's very much driven by what is the epidemiology in a jurisdiction. So the provinces that are lowering the age group, it's because the evidence would say that even at that lower age to down to 40, that when there's a high prevalence of COVID, that there's a significantly increased risk of a severe outcome for somebody even at that age group from a COVID, and that there's less risk from the vaccine than there is from COVID. But their statement also says that in places of low prevalence, which so far we are in Nova Scotia, that people below age 55, the risk of a severe outcome, ending up in hospital or even dying, is greater for the vaccine than it is from COVID. So it's all driven how the decision and the age group that provinces use for AstraZeneca is really driven by this epidemiology and the balance of risks and benefits. All of I was in discussion with the Atlantic Chief MOHs. We're all in a position that we're going to continue to use, because of our good epidemiology, we're going to continue to use AstraZeneca for the 55 to 64-year-olds, simply because of that massive evidence of where the balance of risks and benefit actually the cutoff is, and it's driven by epidemiology.
And so just on that note, because again, the 55 age group will be the next one that's eligible for Pfizer and Moderna. So what happens if we have all this AstraZeneca that nobody wants?
Well, we project we may have around 10,000 doses. We don't know where epidemiology is going to go. So the best thing we could do, it's out in pharmacies. It doesn't expire until the end of June. So the best thing we can do right now is leave it where it is, and we need to let the next few weeks evolve to say, we may be in a situation where all of a sudden our epidemiology is different, and we have to then think about how we use the vaccine. But we have it there, and we have some, let's get through the next few weeks. And as I said, it doesn't expire. So we have some time to figure out what is the best way to use that vaccine.
Next, we're going to Tim Bousquet with the Halifax Examiner.
Dr. Strang, I guess there's a category of person that would buy a house because they're looking to come here to avoid COVID elsewhere, I guess. But what about a regular working person who got a job and has no hope of buying a house, but they might have a lease? Or will they be able to come here?
Well, I think this is a 4-week period. So we have to work out some of the details. All of the things we put in place, there is the capacity for people almost to make an appeal. But in general, that we were saying that we need to slow down the flow of people that are coming here.
And so my follow-up is the World's Women Hockey Championship, is that essential, or will they be allowed in?
So I've worked closely with that. They have a very strict protocol, and they essentially, if they come here, they will be in a bubble that they will have no interaction with Nova Scotians. They have very clear protocols about individuals and teams, and even the whole tournament. Once they're out of their quarantine, they will still be not interacting with Nova Scotians. So that tournament does not, in my opinion, does not present a risk of bringing COVID and then transmitting it into Nova Scotia, with all the very strict protocols they have even before they leave their home countries.
Now let's go to the phone lines. We'll start with Keith Doucette from the Canadian Press. Keith, go ahead.
Yes, Premier, you mentioned the unevenness of the vaccine supply in the next few days to 2 weeks. I wonder if Dr. Strang can give us a few more specifics. My understanding it's Moderna that's supposedly not going to be filling what they thought they would be, and that Pfizer might fill in the gaps. Can you just give us a few more details on that?
Yeah, I mean, it is the Moderna. I didn't get a chance to get briefed this morning on all the details, but it is the slowdown and delays in the Moderna vaccine. I'm not aware that in the short term, we're getting filled in with additional Pfizer vaccine. Longer term, as we get into late May and June, we're expecting to get even more Pfizer vaccine than we initially anticipated.
Keith, go ahead with your follow-up.
Yes, and I'm wondering, Premier Rankin, have you actually talked with Premier Ford in Ontario? And if you have, could you tell us what he asked for and what you told him?
I did reach out to him after I spoke to the Prime Minister and just said, look, I know you're going through a challenging time, and we'll see what we can do to help. But he was very receptive to anything, but he referenced the help in the ICUs, having actual trained nurses and doctors there. So also talking to other premiers in Atlantic just to see what they're thinking, if they're able to send. I know Newfoundland is, I know PEI is looking at it, New Brunswick's still looking at it, same as us. We all love to help, but we also want to help the country get to population immunity, which is why it's important that we keep on our track for vaccine delivery here.
Next, we have John McPhee with the Herald. John, go ahead.
Thank you. This is for Dr. Strang. You say the travel restrictions are a temporary measure. Will you be looking for a particular or a dramatic drop in COVID cases before you consider opening up the borders again?
I think I don't have a specific number in mind. What we would need to see is where we're at with COVID activity a month from now in other parts of the country, and what border measures we might need to keep in place again, we would not want to open up too fast and then have kind of a pent-up demand to come to Nova Scotia all of a sudden, come flooding here. So we'll have to look at that as we get closer to that 4-week period.
John, go ahead with your follow-up.
Thank you. Regarding the community testing that will be done or is being done in the Lower Sackville and other areas, is this related to cases that are under investigation or to the recent school cases? Exactly what's going on there?
So as I said in my remarks, we've got several clusters of cases. Some of them we know that they're links, that there could be in people that are in close contact in a household, but we may not know where the original source was. Others we're not clear of the links yet through our investigation. So we've got a small number of clusters that we need to allow the investigation to happen. But like we've always done, when we get these, we actually go in along with the targeted testing around known cases and all their contacts, and as we're supporting testing in the schools because we've identified contacts in the school. We also then go into the community and say we need lots of people in those communities to also be tested to see, and that is one of the ways we've always allowed ourselves to keep ahead of the virus. So we look aggressively for any signs of yet undetected community spread in the surrounding communities.
Next, we have Heidi Petriak with CTV. Heidi, go ahead.
Thank you. A question for Dr. Strang. When cases come from travel or they're travel related, do we know if they are, a higher percentage of them are rotational workers, or if it's non-essential travel, or, do we know the nature of the travel that's kind of responsible for cases related to travel in this most recent time?
Yeah, we look at that. So we know that in the last, I think it's 5 days, the cases, 40% of those have been either temporary foreign workers or rotational workers. So we look at that, and as I said, those are the ones that we have very clear protocols and that require quarantining or modified quarantine and testing. So those are the ones that, quite frankly, they don't actually give me as much concern because we expect to see positives in those people, and they're following the required protocols that minimize spread, the potential for spread for Nova Scotians. It's other cases where people either not following the quarantine or and then they're spreading it out, and then we get, as we're seeing now, these little clusters that are much more concerning to me.
Heidi, please go ahead with your follow-up.
So with the travel restrictions then, there are groups of individuals that are exempt who have to follow other, protocols. How closely are they followed through with to make sure they are self-isolating, that, that they do go to a hotel and that kind of thing? How does the follow-up process work?
So we do audits, but that's one of the things we got team, we're working with right now. How do we increase our oversight or enforcement of the quarantine? How do we layer on perhaps stronger requirements around testing? Those are all things that, we really started working on this just yesterday. We're working through a lot of those. We'll have more information on that in the next day or two about how this whole process is being ramped up.
Next, we have Radio Canada, Adrienne Blanc. Adrienne, please go ahead.
Hello. What does it mean for the Atlantic bubble? Should we still aim at a specific date or look at data day after day?
Well, I think it's fair to say, I think the last date we were saying was soonest would have been May 3rd. That's clearly not going to happen with that falling in the 4-week period that we're saying today that no non-essential travel into the province. That's the right decision. I just had a brief call with my colleagues in our neighboring provinces. We'll continue to have that discussion. As you know, PEI also has restrictions for non-essential travel. So we'll have that discussion when it's a little safer to do so, but this is the right decision now as we see the travel is often the case or the close contact to a travel. So we need to make sure we're taking this and not focusing on opening up to a bubble at this time.
Adrienne, please go ahead with your follow-up.
And Dr. Strang, you alluded to it, but what are the precise rules for parents who come to pick up their students at the end of the school year? Do they have to isolate?
So if they go, we have a modified protocol. So for instance, if they go into New Brunswick, which is many of them, if they go and pick up and come straight back, they can, there's they don't have to strictly quarantine, but there's a whole protocol which they have to follow. If they're going beyond that into other parts of the country, they can come back, but they are going to have to quarantine when they come back. So that we have a different approach with travel to New Brunswick versus to going to Quebec or Ontario. But if it's Quebec or Ontario, they're going to have to do a strict 14-day quarantine when they come back.
Next, we have the coast, Victoria Walton. Victoria, please go ahead.
Thanks. So I just wanted to clarify. So right now, do we have the Nova Scotia borders remaining open to people coming from PEI and from Newfoundland?
That's correct. We haven't put any. All the border measures we're talking about are for people coming from New Brunswick or provinces that are west of New Brunswick.
Go ahead with your follow-up, Victoria.
Okay, great. And I guess I wanted to hear a bit more about this 400% increase at the border. Do we think a lot of this is because people are coming here because we have less COVID? Is it just the typical people who we see coming this time of year? Is it pent-up demand, like Rankin said about, or Dr. Strang, you just said about, people wanting to come here to see their families? Do we have any indication of why so many people were traveling here?
Well, I don't think we have a comparator because we haven't had this. This time last year, the border was shut down tightly. What we do know is the border folks are seeing a significant increase that in the last short period of time of many, many more people coming from Ontario, especially they identified Ontario. We don't have reasons why, but if you look around, we know that Nova Scotia has been seen as a place where it's safer, that our real estate industry is benefiting from that, people going to move here to live. But I'm not going to speculate on why people are many reasons probably for leaving Ontario. But what we do know is that a significant increased volume, and because they're coming from areas of high rates of COVID, there's significant risk of bringing COVID into Nova Scotia. So we have to stop that and only allow people that it's essential for them to travel at this point in time.
Next, we have CBC, Jean Laroche. Jean, please go ahead.
Good afternoon, Dr. Strang. You mentioned that about 40% were temporary foreign workers of the cases we currently have, and that means 60% are not. And you also talked about evidence of people not quarantined. What is that evidence that people are flouting our quarantine rules?
Well, we know, and so it was 40% of the cases were either temporary foreign workers or the rotational workers. We know that I think by and large people are quarantining because if you look back, even the last several months, we've had a lot of people that are traveling test positive and they've maintained their quarantine. And so I think by and large people, the vast majority, are doing the right thing. However, especially when we now have highly infectious variants, it doesn't take very many at all to not be following to create spread. What we do know is as we followed up a cluster of cases, we are aware that we're seeing more and more cases that we can now link back either directly or through one or two chains of transmission to an event that happened in a community where certainly as we followed up cases, it's been reported that there were people from Ontario who obviously were not quarantining because they were at this social event in the community, which has now led to a number of cases. But that's all it takes is one case. People not quarantining, but also Nova Scotians who chose to then socialize with people who they should have known should have been under quarantine. So it's both the people quarantining, but also the Nova Scotians and what choices we're making as well. And on knowing that all of us making choices, there are impacts of those choices for all of those around us.
Sean, please go ahead with your follow-up.
And Dr. Strang, you said a 400% increase. Do you know in terms of numbers from what to what? Because, if we have a small number coming in and then the 400% jump is relative to the numbers.
It was just a brief, we were rapidly trying to get some intelligence, and I got a brief text that said we're seeing recently a 400% increase. I don't have absolute numbers, but regardless, even if it's fairly low numbers, a 400% increase is concerning because given the high infectious nature and the high likelihood of people coming from outside of Atlantic Canada, the high likelihood of them actually carrying the COVID virus.
And that is all the time we have today for questions. Go ahead, Premier.
Thank you, and I want to thank Nova Scotians for continuing to follow public health protocols. Continue to keep your social club, your social group as small as you can. Continue to wear your mask. These are important protocols, and I thank you for not traveling unless it's absolutely essential. Of course, we want to welcome people to our province, but now is not the time to come to Nova Scotia. So respectfully, just stay in your province as we continue to make sure that we're looking out for public safety. And when it's time to get vaccinated, to ensure that you book your appointment for those over 60. And for other Nova Scotians, now's the time to get out and get tested at the clinics that are set up now, the pop-up testing areas, which I'm about to do right now as I go across the street. So thanks very much for Nova Scotians for following our guidelines, and we'll see you again soon.